So just for the purpose of the recording, Angela, can I just have you state your name, your position, and your organization?
My name is Angela Lunde. My position is co-investigator and cognitive health and wellness director at the Alzheimer's Disease Research Center at Mayo Clinic.
Thank you very much, Angela. So this week we're talking about good palliative care. What is good palliative care?
Good question. And one of the things that I really looked forward to receiving out of this meeting was even a deeper understanding of what that means. I think...
I'm just going to stop you.
Yep.
My questions are not going to be on the recording.
Okay.
So,
got it. Thank you.
So if you're able to repeat the question in your answer, that'd be great.
Sure.
And I'll be
Perfect.
totally edited out of this.
Perfect. Got it. All right.
I'll just ask you a prompt again. So what is good palliative care?
Good palliative care, I think, is really looking at what we can do to really support the whole individual. It moves away from a common way of thinking about care, which is a medical way of thinking about care. Not that good palliative care doesn't include that, but good palliative care really looks at managing the physical symptoms, the emotional symptoms, the stress that might come from having a disease. Probably what makes it palliative is just an understanding that it's probably somebody who may have a life-limiting illness.
And why is good palliative care so important for dementia patients in particular?
Good palliative care is extraordinarily important for dementia patients, and I think it really just aligns with the way that I'm beginning, and I hope others in the field are really beginning to look at what we can do to really meet the needs of somebody impacted by dementia. One of the important messages that I think is coming out in my country, and I think probably in others as well, is this idea that even though a person has a diagnosis of dementia, maybe due to Alzheimer's disease or something else, that first and foremost, they are still a person. And they still have the same needs, physical needs, basic needs, and emotional needs. And that those needs don't diminish just because somebody has dementia. So, however, a diagnosis of Alzheimer's disease or a related dementia does mean that this person, may likely die of causes due to their illness. But at the same time, if we really apply palliative care model, and I would really propose, and one of the things that I hope to take back with me from this conference, I would really propose that a palliative care model should really be implemented at the time of diagnosis. Because then it really coincides with what I think of is basic good care for somebody living with dementia. It would take a look, it would look, number one, at just making sure that, yes, their physical needs are being taken care of, but I think even more important with somebody living with dementia is that there's also an understanding that their spiritual needs still need to be met, that their emotional needs still need to be met. And maybe what's really important, and I think sometimes forgotten in dementia, is that people with dementia can still make decisions really well into their disease. They might not be able to remember, something that somebody told them a while ago, or they might not remember to take a medication. They might need some assistance or cueing with that. But people with dementia maintain the ability to share their perspective, their opinions, their ideas. They're innately curious and creative, which means that if we think about the whole idea of being a participant in your own care and in your own well-being, people with dementia really have the capacity to do that well into their disease. I think one of the things that often occurs when somebody receives a diagnosis of dementia is there's this assumption that with that label, this individual can no longer do certain things, certainly not make decisions on their behalf. So I think the whole palliative care model hopefully takes this message and really underscores that the person is still there, see the real me, and I really can continue to make decisions, and I still have the same needs that anybody without this diagnosis would have.
Thank you. What So we're at this we have sort of very global gathering. We have people here from the US, from Africa, from Asia, and we're talking a lot about what sort of examples we can share or follow. When it comes to the US context, what do you think the US is doing well with regards to palliative care, especially with regards to dementia patients?
I think, I think with regards to dementia patients, we're not always using the term palliative care when we apply care, and that's maybe neither here nor there, but I think a lot of people in this work have really been doing good palliative care for quite some time. We just might not recognize it as such. So I think that it's there. I think the quality of good care is there on one hand. But I'm also going to be realistic and really share that I've seen and I've heard and in my experiences with individuals impacted by this disease, as the disease begins to progress, and as individuals have less and less ability to verbalize their needs, I think the ability for even good family members and healthcare workers to really apply a palliative care model or a person-centered model begins to diminish just a bit. I've seen and I've heard too many situations where people who have the later stages of dementia suffer more, they're more isolated, they're more lonely, they're not receiving good care, they have more bed sores. And partially, I think a lot of that is because, without the ability to verbally tell somebody that I'm in pain, we have to look for other methods to do that. I think that people living with dementia communicate what they need in a lot of different ways. And part of what I think we're doing in the United States, and I know a lot of other countries are as well, is really beginning to fine-tune how we care for individuals living with this disease by seeing other ways of understanding communication as the disease progresses. Because I think we do have, and I think one of the things that this particular conference really highlighted is the recognition that as people go into the later stages of a terminal illness, so much of what they need is so much of what we actually can provide. And it's not a hopeless, devastating, and it can actually be an experience that can be lovely. But we really have, I think in order to make that happen, we have to really have a way of thinking about caring for somebody and apply that. And
have you heard any examples this week from other countries where you think that they're perhaps doing it better, examples that you could follow in the US?
I think one of the common things that I heard from a number of different people, with a lot of examples around it, but it's a common theme that I heard. And one common theme that I heard was the ability to really listen. And I think that, as simple as it sounds, is a really impactful and profound message. Because people living with dementia, even in the later stages, communicate. It might mean that our presence needs to be more impactful, but also even listening to the whole family system, who probably knows a person living with dementia better than anybody else. So I think one of the main things that everybody needs, whether you have dementia, whether you're a care person of somebody living with dementia, is there's such a therapeutic quality to stepping back and to just sharing and being part of somebody's space.
And what will you be personally taking away from being here? You said you're coming back again next year.
Perhaps.
So
yeah.
Hopefully. Why is it important to come to these sort of like international gatherings to talk about things like palliative care and dementia? And what will you personally be taking back to Mayo?
Good question. I think it's important to come to these kind of international gatherings around a particular topic. Couple of main reasons. One is it gives you a much better, obviously, perspective on how other individuals look at these particular issues. It gives you a well-rounded perspective and a recognition that there are different ways to really do things. There's different models out there. There's a lot of really good, innovative things that people are doing. But what's really refreshing and really needed is that when you come to meetings like this, you really recognize that at the core of everything is the sense that we really all still want the same thing. We want to go through our life knowing that there's somebody who cares, who's probably going to walk alongside us and has the compassion and the empathy to really support us in our journey. It seems to be that's what everybody wants. We just sort of go about it in different ways.
Thank you. Is there anything you wanted to, I've asked all my questions. Is there anything you wanted to highlight or clarify or change at all?
I don't think so.
Good.
I don't think so.
Case,
Yeah.
well done.
All right.
Thank you so much.